Okay, for the sake of time, I'm going to go ahead and get started. Hello everyone. I just want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. So my name is Autumn Sipis. I am the project coordinator with the Canadian Coalition for Green Healthcare. And on behalf of the Coalition, Peach Health Ontario, and the Canadian Association of Pharmacists for the Environment, I would like to welcome you to today's webinar, Climate Change in Pharmacy, A Place for Everyone. Throughout the webinar, please use the chat function for any technical issues you may be experiencing, use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of the webinar today. We are also recording this webinar, and it will be sent to all registrants as well as be available on our website and YouTube channel at a later time. I will now hand things off to Dr. Miles Sargent to introduce today's speakers. Take it away, Miles.
Thank you very much, Autumn. I will be introducing the speakers today and likely helping out with the Q&A at the end. So we do have 5 speakers. We're really excited to have CAPhE here today. They're doing amazing things in the world of sustainability. And I'll start with the first intro, which is Shaliza Sajwani, who is a pharmacist who works within areas of climate change, global health, and oncology as they relate to the pharmacy profession. Shaliza received her M.Pharm from Aston University in the UK, her PharmD from the University of Toronto, and her Climate Change and Health certification from Yale University. She is the national co-chair of the Canadian Association of Pharmacy for the Environment, CAPhE, and is also the co-chair of the Ottawa Hospital Pharmacy Environment Committee. Shaliza also co-chaired the International Pharmaceutical Federation Policy Committee, which created and passed the first ever international Pharmacy Climate Change Policy in 2023. Shaliza.
Thank you so much, Miles. And it's lovely to see all these different faces here today, or all these different names here today. Whether you are a pharmacist, a pharmacy assistant, a pharmacy director, pharmacy manager, whether you work in industry, community pharmacy, hospital pharmacy, or academia, this presentation is very relevant for you. And super excited to lead us off and also bring in so many amazing members also from CAPhE, who are leads with our organization as well. So with a quick overview, we are not taught about climate change in pharmacy schools. So those of you who know this already, just bear with me. But for climate change specifically, we know that we emit greenhouse gases. Those greenhouse gases basically trap the sun's heat. And then because of a whole host of factors, temperature rises, and that leads to a whole host of consequences. And those consequences also lead to health-related challenges. Often we say, this is a time of urgency, and it's also a time of opportunity. The IPCC has mentioned that we can act on climate change, but time is running out. So this is really the time to where all hands are basically on deck. The bottom line is that we are not on track yet for the Paris 1.5 to 2 degree limit, but positive things have started to happen, and we can see those positive changes across the board. And political interest is also clearly growing, but in order to be successful, we also have to make sure that we're acting now and not necessarily waiting for decades to act. So the all these goals by 2050, for example, we need to really make sure that we're focusing in on now what can we do at the moment. So a quick overview: greenhouse gas emissions lead to more than a quarter of global deaths from heart attacks, strokes, lung cancer, chronic respiratory disease. And we're also seeing that more deaths will likely occur because of infectious diseases, diarrhea, and heat stress. If you think about this from a care plan perspective, think that, heat increases cardiovascular morbidity and mortality. Changes in temperature and changes in precipitation will affect, your infectious diseases prevalence and incidence. Mental health is is an obvious one that I'm not going to get into here, but you can really see that every area of health is affected. Air pollution causes worsening respiratory diseases, and even my own field of oncology is also very much affected. Every area of cancer is affected because of climate change. With regards to the role of pharmaceuticals, we know that first, we know that healthcare systems have an even higher emissions burden than the airline industry. And I will say that once more, healthcare systems have an even higher emissions burden in terms of global greenhouse gas emissions than the airline industry. And medications actually account for a quarter of that. So we know that we as pharmacy professionals are all on the front line, whether we are pharmacy assistants and technicians to pharmacists to people who are working in management areas. Typically, when we think about climate mitigation within pharmacy, we're looking at how do you reduce emissions, and often people talk about plastic a lot when they first think about climate change, but actually plastic and pollution in general is a separate and indirectly related issue, but it's not specifically a directly climate related issue. But it is important though, because it also affects planetary health. The plastic in the aquatic systems and the pharmaceutical pollution in the aquatic systems affects what we are exposed to. And that also has a host of health effects as well. But when we think about emissions specifically, we often think about various areas. So we think about deprescribing and clinically appropriate deprescribing, where we're reducing prescribing of a particular medication. We think about certain medications like anesthetic gases and inhalers, where certain anesthetic gases and inhalers have a much higher emissions footprint than others. We think about procurement for those of you in industry, or for those of you who are are looking into working with inventory and thinking about ordering. There's a huge area on sustainable procurement, and how do you reduce emissions within that area, and how do you come together to basically state that this is an area of need and of preference, and financially, there are systems in the UK, for example, where healthcare systems, industry actually basically competes for each other in order to try to gain contracts, and the contract itself has 10% of the entire weighting on environmental criteria. So basically, industry then competes with each other in order to try to reduce emissions to be able to get the contract. And work in this area has also started to come forward with the efforts of group purchasing organizations. And then you have the whole area of trying to reduce plastic and looking into your own pharmacy processes, thinking about how do you reduce waste there and how do you reduce emissions there. So different types of groups are looking at that as well. Within mitigation, so you can see the deprescribing, the anesthetic gas review. Sorry about that G at the very end. So basically, with desflurane, desflurane has a much higher emissions footprint than other anesthetic gases. Meter dose inhalers have a higher emissions footprint than dry powder inhalers. And then even within meter dose inhalers, there's some that have a higher footprint than others. Cascades Canada has a really good ranking of all the different inhalers. And clinically appropriate deprescribing is also very important. Then if we think about climate change, we also want to think about how do you improve the resilience of healthcare systems to existing climate hazards, because the climate crisis is not something in the future, it's something that's happening right now. So because of that, we need to think about how this affects all of our specialties, how this affects disaster plan recommendations, and how do we strengthen supply chains in order to try to reduce the amount of back orders and stockouts. So for disaster plans, there's a few different types of information out there. The Canadian Pharmacy Association has put out some really good information on thinking about, for pharmacy managers, what do you need to think about for disaster plans. Within my own area of hospital pharmacy, there's some really great reviews out there as to what could be implemented in order to try to improve the resilience of pharmacy services. And you can see the Saskatchewan College of Pharmacy is one of the colleges that has also put out a preparedness kit for pharmacists and pharmacy technicians. Something to think about: if a disaster happens 100 kilometers away from you, you have evacuees who are basically coming to your pharmacy. What would you need to make sure that what would we need in place to make sure that they're able to get care? What about the impacts to hospital pharmacy? What about the impacts to community pharmacy? So planning is crucial in order to improve resilience. So just a quick plug for the Canadian Association of Pharmacy for the Environment. Kind of a nice fairy tale-like story. A bunch of pharmacy professionals, technicians, pharmacists, directors came together across the country. And then 2 years later, you know, we have a constitution, we have a strategic plan, and we also have key partnerships with the Society of Hospital Pharmacists, the Pharmacy Association, Cascades, and several other institutions, including the Canadian Coalition of Green Healthcare, for this particular education today. Our strategic plan has just been released and it's available to view on the website. And it includes trying to work towards more systemic initiatives, trying to continue to build champions and work on organizational sustainability. And there's also a recruitment form there if any of you are interested in volunteering for our organization, as we are currently primarily volunteer-based. Elsewhere, there's a whole bunch of other organizations doing some great work in this area specific to pharmacy. Cascades has a nice pharmacy playbook, which we co-branded with them. RX for Climate is an international small group of climate pharmacy professionals. CSHP has come up with a great sustainability task force, which we've worked in collaboration with them to help create and implement. The Pharmacy Association has also done some great work, and the FIP also is basically the body that represents pharmacy on the WHO level, and they just published a policy in 2023 that has some good recommendations for community pharmacy, hospital pharmacy, regulators, academia, etc. And then there are also other groups. I'm personally part of a group called Climaceutics Health Solution that helps specifically for community pharmacies as well. So this is the slide that also gives me a lot of hope, and we'll have to start reducing the size of the images as more groups kind of come in as well. And that's it for me.
Okay, thanks so much, Lisa. And I forgot to tell you, it's $10 for a plug. So, okay, our next speaker, Ariane Blanc, is a bilingual hospital pharmacy leader with more than 20 years of extensive academic, professional research, and mentorship experience in adult and pediatric hospitals and pharmacy community settings in Ottawa, Montreal, and Paris. And I mean the big Paris here, that's France, not Brantford. She is the Director of Pharmacy and Chief Clinical Pharmacist at CHEO, Research Investigator at the CHEO Research Institute, and Adjunct Professor at the University of Ottawa School of Pharmaceutical Science. She also leads the Regional Shared Service Program, which provides a specialized service to 9 Eastern Ontario health hospitals. She is a preceptor for international and national pharmacy students. And in 2022, Ariane founded and has been chairing the Canadian Pediatric Hospital Pharmacy Leadership Group. She volunteers at the Canadian Society of Hospital Pharmacists Ontario branch as the president-elect since December 2023, and was the Education Committee co-chair from 2021 to 2023. And that's not all. Ariane is very busy. Ariane, you're up.
Thank you so much, Miles. I'm sorry, I was trying to unmute. So hello, everyone. I'm really happy to be here and excited to share my journey as a leader when tackling sustainability practice changes. Next slide, please. So I just want to start. I did the presentation as 8 steps, as I had like 8 minutes dedicated for that presentation. And my first step through my journey was a spark that leads to passion. So I had the opportunity in 2014 to do a summer space program with the International Space University. And I met with different key stakeholders during that program and astronauts. And one of the things that really sparked my passion about environment and sustainability is the fact that the astronauts share that when they are in space, they realize as much as the planet is so fragile. And when you look at the picture below, you can see the thin line, the blue line, which is the line that protects us and enable us to breathe our air. So this really sparked into me about the fact that we need to do more and really protect our planet. And also it triggered my first project within a group of 30 people, international, coming from different backgrounds, and worked on a project on aerospace, space, and planetary health. And next slide, please. So the next step when I started my role at CHEO is I wanted to see how we can do more with our pharmacy department. And for that, it's to gather knowledge. So I quoted Neil Armstrong here as the search for knowledge is what brought men to the moon, but it took knowledge already acquired to make it possible to get there. So I was happy to see that our organization had a pillar, a strategy pillar about sustainability, and I wanted to see that it's translated into our pharmacy department. So I reached out to MBA students at the Telfer School of Management, and we worked together on a project to better understand what's out there. We did an internal survey and then a provincial survey to see how hospital pharmacy staff and leaders tackle those challenges and their awareness about sustainability within pharmacy, and what are their challenges into implementing change. Next slide, please. So once we gathered that challenge, we share that knowledge, and it's really enabled to create a momentum. So we presented the poster that you see, the extract of the poster here at CHSP Together Conference in 2023. And also we were fortunate to win a prize too, an award for that project. And it really triggered connection. So I had the opportunity to meet with other pharmacists and pharmacy leaders that wanted to do more in sustainability. And I joined the CAPhE team at that time. And then also it's attracted attention within CHEO. And then we won a contest, which is the Kick the Carbon contest, which freed up some funds so that we can continue to work on our sustainability project in pharmacy. And also I joined the CHSP Sustainability Task Force. Next slide, please. And then step 4 is really to reframe challenges. So we did another survey, which was a national survey that we presented last weekend at CHSP PPC conference in 2024. And what we learned from hospital pharmacy staff and then leaders is that there's a strong willingness in doing more and participate in sustainability practice change. But first, they didn't know where to start. And second, they faced 3 main challenges, which the team was cost, time, and also complexity of tasks. So when looking at those challenges, how can we make these challenges change into opportunities so that we can create, again, momentum? So my learning through my journey is really engage with your leaders. So for example, at CHEO, as I said earlier, we had an organizational strategy. So ensure that you can see if your department or where you work can also translate into department strategy. Because if you do, it's going to really help in prioritizing project on sustainability, but also it can help you in freeing up some funds and resource. And another thing that I learned is that often when you ask for funds, then they will ask for, what's going to be the return, right? How are you going to show results? And one of the key things about sustainability is often it's based on carbon footprint data. So we're still at an early stage, but we are gathering more and more knowledge on that. So as we have more knowledge, then we'll be able to show more results. Also, it will help to free up dedicated time and create team collaboration. So maybe creating, for example, a green committee within your group, or if there's one that already exists, maybe to join that team. Also, it will help in opening channel of communication to share your projects and results. And finally, what's really important is when you want to work on sustainability project, and ensure that, of course, you have the planning and the implementation, but also important to include the PDSA. So you plan, you do, and then you check, and then you reassess. Next slide, please. So the step 5 is really to prioritize for success, because as Shelisa shared, like sustainability, there's a lot that we can do. There's a lot of things that we can work on, but we cannot work at every place at the same time. So by really looking at which quality improvement to tackle first, it will help in ensuring that you're going step by step and reaching out for success. A key thing would be first to see what would be the most positive impact within your team or what you want to do versus the amount of resources needed. So you can look at carbon footprint, as we talked earlier. You can look at also, is it easily operationalized? The number of key stakeholders that you will need to bring upon in your projects. And is it something that you can do within your department? So for example, something that's only related to your operation, or will it need to be bigger and then interdisciplinary team? And then, as I said earlier, like the return on investment, because if you reach out to have the collaboration, I'm so sorry. This is a perfect example. We are reducing lights, so I'm not moving enough. And then the return on investment, because again, you will need to show results if, for example, you need a resource for that project. Next slide, please. And then step 6 is enabling feasibility. So one of the key things is if you have a project you want to tackle, if you do a pilot, for example, or an environmental scan, it will help you to better understand the feasibility of your project, how it's going to be for implementing, so with planification, also showing that pilot results will help with the engagement of your team, your collaborators, but also leadership. It can help you in having more funds for your next phase after the pilot. And again, sharing knowledge with, as we talked about, is really important to create momentum too. So this is just on the right, you can see a poster we presented at PPC last weekend. And it's an example where we wanted to do more for inhaler use within our respirology clinic. But as we were starting to already planning for implementing change, the first step was like, well, let's see first, what's our current situation? How many inhalers do we prescribe? And what are the gaps? As you know, or probably if you don't, well, pediatric, you're not always able to change or use a powder inhaler, for example. So we wanted to see, is there an opportunity for change? And if so, what would be the impact? And with these results, we can then share knowledge and then create engagements, because it's going to be the phase 2 of our project, which is going to be to have our prescriber collaborators and then see how we can include some practice change for the next phase. Next slide, please. And then step 7 is really resource and partnership. So we are stronger together. And as Shelisa shared, like there's a growing sustainability committee. So it's really important to leverage that committee to reach out. And I put CAPhE, Cascade, and CHSP Sustainability Task Force here, but there's a lot more, as Shelisa shared earlier. And also, if you're looking for funds or grant application, when you partner with other people, it helps in being more successful in obtaining those grants. But also, if, for example, it's your first time in applying a grant, if you want to partner with somebody that maybe did it in the past, then again, you're setting yourself for success. Next slide, please. And then finally, step 8, it's really important to time take a pause, reflect back on all the amazing things you have done, and then, regrouping your energy and then start again. And this is going to be the path to reach the stars. So my key points to share with you is follow you and share your passion, collaborate with colleagues from various backgrounds and horizon, learn from your peers and be generous with sharing your knowledge, look out for opportunities to invest in what you love. And when project ideas seem too big to tackle, break them in smaller projects and push yourself outside of your comfort zone, and you will reach the stars at Astra. Next slide, please. And then now let's serve the sustainability wave together. Thank you so much.
Back on. Thank you so much, Ariane. That was wonderful. Our next speaker is Tariq Hussain, who is a PharmD, MD, MBA, BSc Pharm, RPH, CMGR. I don't know. You'll have to tell us what that one is. LSSGB and a DTM. That was a lot of schooling. He is a healthcare innovator with a unique blend of clinical, business, and process improvement expertise. He is passionate about sustainable healthcare solutions, equity, diversity, and inclusion. As a pharmacist, clinician, healthcare consultant, and certified Lean Six Sigma Green Belt, he is passionate about improving patient care, operational efficiency, sustainability, and innovation within healthcare. Tarek is also an equity, diversity, and inclusion champion who bridges the clinical and social care gap through research, training, and education. Tarek.
Thanks, Miles, for this big introduction, and welcome everybody. Thanks for Shaliza and for Ariane for the wonderful talk. I'm going to talk about something different a little bit, but it is in the heart and core of sustainability, which is social prescribing. You probably heard the term. People talk about it a lot, but today we'll get into what is social prescribing and how can you start embrace it in your practice. Next slide, please. So these are my objectives for today, and I will start by the why. So next slide is about why social prescribing. And the best way to explain the why, next slide, for you as clinicians is basically sharing the CHR model, which is the county health ranking model. And this model, as you can see, shows that the health determinants exerting the most powerful and sustainable influence on health and the distribution of disease, illness, injury, disability, and premature deaths in the population are social and economic factors. And they contribute to almost 80% of all the factors that are affecting our health. And those factors has been coined by the WHO as the social determinants of health. That these are the words that you all know, which are defined as the conditions in which people are born, grow, live, work, and age on. Next slide, please. So out of those 80% health and well-being factors that they are non-medical, they translate in our clinical practice, just the next slide, to around 50% of the visits that we see in primary care. 50% of the visits that we get in clinics are basically for non-medical uses. And that is really interesting. And that is something that I just want to share with you to start to switch or change our thought about priorities for health. And if we go for the next slide, we will see that this is basically the stream of kind of care. And in this stream, we need really to move upstream. As you can see, because we are working on the downstream area, we're providing care, clinical care, but we need to go to the upstream where we need to start to implement strategies to improve community connections and social well-being and all these interesting aspects or important aspects in order to integrate social care into healthcare delivery. So, and for the next slide, this makes sense because as Sir Michael Marmont, who's the father of social prescribing and social determinants of health, said kind of like correctly, we keep treating people and sending them back to the same condition that made them sick. So it doesn't make any sense. And I think you will agree with me. How many times you see somebody you treated for a specific issue, let us say anxiety or diabetes even. The most common example I like to give is about molds. People get a lot of lung issues with the molds. They come back, you come to you, they give them all the treatments, they go back. If the molds are not treated or removed from the housing, they will kind of keep getting the same problem again and again. So we need to change the condition where people live. And 80% of them, as I just mentioned, are non-medical in order to be able to treat and improve health quality of our people. So next slide, please. So this is about the why, and I think we all see the importance here. But what is exactly social prescribing? Next slide. I'm going to use a definition, the very recent definition that was coined by my colleague Caitlin Moll, and she's one of the co-founders of the Student Collective at Canadian Institute of Social Prescribing. And she did a Delphi study that actually got a consensus of around more than 60 to 80 experts around the world about what is the definition of social prescribing. And basically, it's a means for trusted individuals in clinical and community setting to identify that a person has non-medical health-related social needs and to subsequently connect them to non-clinical supports and services within the community, and by co-producing. And this is a very important point, which is basically the client and the support, the connector who is the supporter, agrees on the type of social need that this client needs. And when they agree about this kind of a social need, that is basically, or service, that is basically the social prescription. It's a non-medical prescription to improve health and well-being and to strengthen community connections. So the next slide will show you in a little bit more details how this is working. There is a client somewhere, and this client will be identified by either a social or a clinical person, okay, who's trusted. So the physician, the pharmacist, the nurse, whoever the clinician is, or somebody in the social sphere of that kind of a client. And once this person is identified, they basically is referred to a navigator, a connector. We call them link workers. We call them well-being coordinators. And this navigator or connector will sit down with the client, will assess all the needs, and then they together will co-produce the social prescription, which is referral to a social or community support to help with the issue that the client is going through. Next slide, please. So basically, this social prescription can be anything. It can be an art class, a dance lesson, community garden. It can be going out in the nature. There is a group in Saskatchewan and BC and Alberta that gives free passes to parks, nature. Can be support, whatever support group or caregiver group or newcomer support. One very interesting example is one of my colleagues who actually founded the International Social Prescribing Pharmacy Association in the UK. He actually was a dancer. He's a pharmacist, but he's also a dancer. And he discovered that there is a very interesting class for improving the symptoms of Parkinson's by doing dancing, special dancing. And that's when the idea came to him to kind of like, okay, I will be an instructor for that class, and I'm providing the social prescription by myself. Next slide, please. So basically, now we know the definition. Now, what is the impact of social prescribing? Next slide. So basically, there is a report that came from the Alliance of Healthier Communities about a pilot they started in 2018, and between 2018 and 2020, there was 1,100 clients from 11 different community health centers across Ontario who were actually, they received around 3,300 social prescriptions. Next slide. And the client, this is the impact. There is the participants found that there is almost 50% decrease in loneliness, 12% improvement in mental health, and 19% improvement in social activity. And those kind of those outcomes have been translated in different research, but in the UK, a similar research showed that between the 2017 and 2019 showed that similar results led to 14% decrease in emergency room visits, 40% decrease in GP visits, which is family physician here, and around 21% reduction in cost to the healthcare system. And when you look at those numbers, it kind of like makes sense that when we reduce emergency visits, when we reduce physician visits, when we reduce the use of medication for anxiety, depression, and other conditions, and replace that with non-medical, we are definitely reducing the greenhouse gas emission in healthcare, which is huge, as Shaliza mentioned correctly and accurately in her slides. Next slide, please. So by doing that, we definitely have a structured pathway for healthcare providers to address social determinants of health. We're bridging the gap between clinical and social care, and we are empowering people to be the co-creators. We are including patients or people or clients in the decision to improve their own health and well-being. Next slide. And Dr. Marianne Issam, which is a very prominent GP in the UK, she actually created a program for social prescribing in pharmacy, a free course. She said in her last 30 years, she has spent as a family doctor. Social prescribing represents the most effective, wide-reaching, and life-changing of all initiatives to that date, which is a very profound statement. Next, please. My last part of the presentation will be focusing on an example of a clinician and social prescribing. And being a pharmacist, I'm definitely gonna love to talk about pharmacy and social prescribing. So as you can see, there is a very, very logic behind pharmacy and social prescribing. Pharmacists are the third largest health profession in the world and in Canada, after physicians and nursing. And actually, they are the frontliners. We have around 12,000 pharmacists in Canada and 11,500, which is almost 90%, are community-based. So we have 90% of our pharmacists are in the front line. They know their clients. They can easily identify clients who need social prescribing services. Next slide, please. Pharmacists also are very trusted, especially after COVID and the impact that pharmacists had on healthcare, being pretty much the only frontline open healthcare facilities across the nation, the immunization, all the stuff. So there is a lot of trust on pharmacists. So that will also reflect on identifying customers and the customers be trusting their pharmacists to talk about social needs. Next slide, please. My colleagues at the ISPA, International Social Prescribing Pharmacy Association, and also they are professors at the University of Newcastle in the UK, Laura and Adam, they did a couple of studies, and they actually started to identify the role of pharmacy or pharmacists and their teams in social prescribing. And according to the definition we shared, pharmacists can be either identifiers, which is basically the major kind of role that we are hoping pharmacists would be able to do. They also can be referrers, so they can refer to the link worker or the connector, but they can also refer directly to the service and work as a connector themselves. And also they can be a provider, and I just give you an example of my colleague, Aaron, who was actually a dance instructor for a kind of a Parkinson's class to improve their health. There's a lot of pharmacists who are lifestyle and wellness coaches, and that is also huge. And you can impact the life of your clients by providing that service. So pharmacists can definitely be on all the levels of social prescribing, but at the beginning, I think we should focus on pharmacists identifying social needs among their clients and referring them to the link workers or the connectors to be able to co-produce the social prescription. Next slide, please. If you want to read more about social prescribing in pharmacies, we just published a paper early January in our Canadian Pharmacy Journal about the social prescribing in pharmacies with the collaboration of ISPA, which is our group, International Social Prescribing Pharmacy Association. And Shaliza, maybe this logo should be added to your beautiful slide so we can increase more organization that are doing that. The next slide, please, talking about a very important document that's been published by Cascades. It's about climate resilience in pharmacy, and there is a clear recommendation in that document that talks about using social or implementing social prescribing services in pharmacy, and CAPhE was very, very well represented in the creation of this document. The next slide also talks about that shows you how social prescribing is important. Cascade has a special primer on social prescribing, green and social prescribing, that is done in collaboration with Canadian Institute of Social Prescribing. Next slide. I just would like to conclude here by saying that I shared with you today the why, the what, and the how of social prescribing. And I'm going to leave you with a very old quote from Hippocrates, says, "The greatest medicine of all is teaching people how not to need it." And I'm leaving you with a pledge to start thinking about social prescribing, implementing social prescribing in your organization. Look around, because you might find it there. If you can't find it, reach out and find how can you implement it in your own organization. And these are my references, and thank you so much.
Okay, thank you. I'm going to keep moving along here. It's 12:40. Our next speaker is Simroop Ladhar. Simroop is a fourth-year entry to practice PharmD student. from the University of British Columbia, UBC, Vancouver. Prior to entering pharmacy school, she completed a Bachelor's of Science degree, majoring in biology, also at UBC. Simrup is very passionate about research and education on climate change and environmental sustainability in relation to pharmacy practice. She has had the opportunity to work as a research student on various projects on this topic through UBC and the Canadian Association of Pharmacy for the Environment. Simrup.
Hi, thank you so much, Miles, for that introduction. So my name is Simrup, and today I will be presenting PharmD student insights on climate change and sustainability education. So to start, I wanted to highlight some of my own experiences as a PharmD student working in the realm of planetary health. I am really thankful to have had the unique opportunity to work on many different projects with various pharmacy planetary health leaders, including working on various projects through UBC and volunteering with CAPhE as a student researcher. As part of today's presentation, I will discuss my involvement in the development of PharmD curriculum content. Next slide. So although I have been quite involved, I would like to note that when I initially started looking for opportunities to work in this area, I realized quickly that either limited opportunities existed or that they were just quite hard to find. To put this into context, I started kind of looking into this area during second year of pharmacy, and at that time, there's no clubs or student-led initiatives taking place on this subject matter. And to my knowledge, I was unaware of anyone doing research in this area. So as research is an area that I'm interested in, I did start doing my own digging into things and reaching out to faculty members. Eventually, I was put in touch with the faculty member who was working on a project related to planetary health. And then from here, things just kind of snowballed and I had the opportunity to become more involved. I would like to mention, though, that from my perspective, it does seem that there has been a really big increase in talks about pharmacy and planetary health over the last couple of years, which is actually really exciting. So another important note was that one of the reasons I wanted to get involved in the first place was during my practicum rotations, I noticed that pharmacy actually generates a lot of waste. So in community settings, there was a lot of plastic and paper being used, while in the hospital setting, in addition to the paper and plastic, I noted that there was quite a bit of medication wastage as well. And interestingly, this was also noticed by my peers, and this was something that came up when we were talking about our experiences in practicum. So next slide. So on that note, I wanted to talk about the BREATHE project, which stands for Building Responsible Environmental Awareness Through Inhaler Education, which is led by Dr. Karen Dari. So one of the goals of this project is to understand the perception of pharmacy students on the incorporation of climate change and sustainability into the curriculum. To do so, we developed a survey that was disseminated to students in year 1 through 4 of the program, and it was sent out through social media and email. Overall, we had 117 out of the 836 students enrolled respond to the survey, and there was an even distribution of responses from each year level. Next slide. Some highlights from our findings were that 78% of students had no exposure to climate change and sustainability during their time in the PharmD program. With 77% of students actually indicated that they felt integrating this topic into the curriculum was necessary. In general, almost all respondents stated that this is a topic they are interested in, with 91% of students saying that they wanted to plan and advocate for sustainable pharmacy practices in their future careers. Next slide. So using what we have learned, we are in the process of actually developing some content to include climate change and sustainability into the UBC second year respirology module. Next slide. Next, I will talk about the Pharmacist and the Environment project, which was led by Robert Pamet. The goal of this project was to develop and incorporate and evaluate a mandatory fourth year module titled Pharmacist and the Environment. So the module consisted of 4 guest lectures, including one of the presenters today, Shaliza. Each presenter presented on a specific topic. This included an introduction to pharmacy and planetary health, an overview of pharmacist role, and discussion of medication waste in hospital and community settings. Next slide. So the content was developed during the 2022-2023 academic year with the first cohort of fourth-year students in October, this past October. So as a part of the project, we also collected student feedback through a post-module survey. And in term one, we had 45 out of 114 students provide feedback. Highlights from the results show that the module was very well received. Almost all students, 98%, felt that they were more aware of environmental sustainability issues in pharmacy practice. 80% wanted more content on this topic throughout the curriculum. And 98% felt that the module itself was an effective introduction to the topic as well. Next slide. So the next steps for this project include assessing the feedback from cohort 2, which was exposed to the content in March. So once all this is finalized, it will be assessed over the summer and any updates will be made. So in summary, through my personal experiences so far, I have learned that pharmacists play an instrumental role in promoting and also developing environmentally sustainable healthcare practices. Through the Breathe and Pharmacist and Environment projects, it is clear that PharmD students do recognize that education on environmental sustainability and climate change is both important and also necessary. Saying that, the current curriculum offers very limited exposure to this topic, but it's really great and exciting to see that work is being done to make a change for the better. And lastly, I would like to note that although opportunities for student involvement in this realm of work exist, it may be very hard for students to find, which was my personal experience initially. So I would like to encourage you all to reach out to different health professional faculties to share your work and also encourage student involvement. And then that brings me actually to the end of my presentation. So thank you so much for your time.
All right. Thank you, Simroop. And next we have Trudy. Dr. Trudy Hugabert is a clinical pharmacist for the Department of Family Medicine at the University of Calgary / Alberta Health Services. She has an active clinical practice and is involved with medical, resident education, quality improvement projects, as well as precepts PharmD students for the University of Alberta and University of Toronto. She is currently the mitigation co-chair with the Canadian Association of Pharmacy for the Environment, CAPhE, and co-chair for the Sustainable Prescribing Working Group with the Canadian Coalition for Green Healthcare. She's also a member of the Canadian Drug Expert Committee with Canada's Drug and Health Technology Agency. Trudy received her Doctor of Pharmacy from Idaho State University and her Bachelor of Science in Pharmacy from the University of Alberta. She also completed her hospital residency at the Ottawa Hospital. Trudy.
Thank you so much. So I feel like I'm like trying to round us all out with all these big hitters. So it's been hopefully very educational in terms of the system level changes that are happening, as well as grassroots changes. And it's very heartening to hear all the changes that are happening in academia. So this project that I'm presenting is really a small scale done in one of our academic teaching centers. And it was just, we want to highlight sort of those small changes can make a big impact. And so Dr. Sverchek is a family physician that I work with closely here, and he teaches at the university. And one of the med students from the current graduating year, it was actually a meteorologist that was interested in climate change. So approached us and asked if there was a project that we would like to work on with him. And so, of course, the MDI project jumped in to full view. And we thought, well, how do we want to do this? So first of all, our goal was to reduce the MDI prescribing. And we wanted to tackle this from two prongs. So one from the staff education in terms of the prescribers, as well as from the patient education perspective, because it's our belief that patients are really the ones that'll motivate these sustainable health changes. And then finally, we wanted to see how our little project really does, if it does have an impact in terms of carbon reduction. So next slide. So how did we do this? So basically we looked at our EMR, or electronic medical record. We developed a list of all the patients that were currently on MDI inhalers, so active prescriptions. And then we looked at that and said, okay, so these are the people that we really want to have a discussion with, and we want to target our education. But we also want, if we provide that education to the patients, we want our staff to be ready to react and respond to these requests. So we did an in-service with the staff first, and I'll show you in the next couple of slides the infographics that Jordan developed. But again, they're available through Cascades. There's a lot of resources available, but we really wanted to utilize what was already done and make that change quickly, but also sustainably. Then what we did after that is the medical, oh, sorry, just almost one more, and then the medical student and I contacted the patients that were on the MDI, active MDI prescriptions, and we offered the opportunity to switch through just a brief 5-minute intervention conversation about the benefits. And then if they were hesitant, if they wanted to change, I would make the change right there. If they were hesitant about it, we would book them in for a virtual appointment with their family physician to discuss further. And then I would be in there as well as a co-visit. And then the other thing that we did on there is we really attacked deprescribing. So people that were provided a one-time inhaler that were on the EMR list, we just discontinued those if it was past 18 months. And so the rationale for that is that then it's a forced function for the prescriber to think about what inhaler they want to choose. Okay, the next slide. And so this was the screensaver, the infographic that our medical student developed. And really there's tons of resources through Cascades that have the active list. What we heard from our prescribers is that I would love to do this, but I don't know what's available and I don't know what's covered. And so I think that has been echoed across the country. And so now there's really good resources available. But we had this on a screensaver in each of the patient rooms. And so when they came into the visit, it was front and center. And then the next slide. This was a patient infographic that we had posted in the waiting rooms as well as in the patient room. So the patients could review it and maybe it would prompt a discussion. Because one of the other things we found is that even though people knew that MDIs were not the greatest choice, they did not realize the impact to our environment. Okay, next slide. So after these results actually blew us away. So initially there were 248 patients on one of the modules in our clinic, and that's where we focused. And after our intervention, so the baseline data was collected in May, and then the post data was collected in August. So over the course of that time frame, we found a 50% reduction in patients with MDI prescriptions. And then also in general, a 43% reduction in the number of MDIs prescribed. That realized a 43% reduction of our CO2 footprint, and that was equivalent to 130,000 car kilometers, which is about 3.25 times around the Earth's equator. So next slide. So the biggest thing that I wanted to highlight in this portion of the talk is that what were our learnings? And one is that teamwork and patient collaboration is the key to success. And like Ariane said in her presentation, when the project looks so big, and it really did to us initially, if you just take a small piece of it and really focus, have a few people focus on it, I think the total time of this project for us was about 40 hours between the three of us, which sounds like a lot, but over the course of 3 or 4 months, it wasn't that much. The other thing we found is that patients were really the key driver. They were really receptive to changing as long as it would manage their conditions similarly. And again, there's a lot of evidence that supports that change. And really, these small changes in your practice makes a huge difference. So even if it's one patient at a time, over the course of a year, that makes a huge difference. Okay, last slide. And so then when we were doing these calculations, we thought, well, what does 31 metric tons of CO2 look like? That was the reduction we found if this change was sustained over a year. That's taking off about 9.5 cars from the roads, about 13,000 liters of gasoline, 7 homes energy for the year, 20 homes electricity for the year. Okay, next slide. And there's some references. Again, I'm always open to collaborate. If you feel like this is something you could put into practice in your setting or tweak it, I'm happy to collaborate with that. Okay, next slide. And I think that's it, and we'll open it up to questions.
Okay. Thanks so much. And we have one. Maya, are you still on, Maya? Do you want to hop on and ask your questions? Is she able? I don't know if she's able to do that. If not, I will. So this is Maya, oh, here's Maya, who is the
Hi, can you hear me?
Kane. There she is. Yes, we can. Maya, go ahead.
Oh, okay, great. Hi, everyone. I loved your presentation. Thank you so much. Full disclosure, I am the president of the Canadian Association of Nurses for the Environment, so there is a bit of bias in my question. But really, this is kind of for any one of you. So if anyone could answer this, I'd welcome it. I actually have kind of a two-part question. But the first is really just generally, I'm wondering how nurses can better work with pharmacists to support planetary health. Nursing scope of practice. Some nurses can do some prescribing, but depending on where you are, that can be very limited. But it can, if you're kind of further up north, it can be quite broad. So sometimes our role really is to support other prescribers. And so, yeah, I'd love to kind of hear your opinion on that. And then sort of as a follow-up question, I am kind of wondering if there are any resources for nurses in our own med rooms when we kind of work in a hospital or something like that, we can quickly compare what is the climate impact or the environmental impact of any one medication, because we aren't necessarily the experts on pharmaceuticals. That's why we have you guys, right? That's your area. So are there any resources that you could point us towards or anything like that? We'd certainly love to promote them at CAPhE. So thank you so much. That's kind of a lot.
Amazing. I
Before
will
you
take a
guys,
crack.
I think Trudy's going to take it, but I'm just going to say it's 12:57. So if anyone needs to jump off at 1, we understand. But for anyone who wants to stay on for a few minutes, we're happy to do that too. Go ahead, Trudy.
I'll just take a crack at the first one, Maya. I think this is great questions. So I work in a collaborative practice in primary care, and I think it is transportable to pretty much any healthcare environment. But really, it's our nurses that are the drivers. So in our clinic, the prescribers, which is the pharmacist, myself, and then the physicians, we can make that change. But it's those conversations that the nurses are having with those patients one-on-one, and they're the ones that are like, "Hey, Trudy, this patient wants to talk to you about MDIs." So I really think that collaboration happens organically. And so sometimes nurses might have to approach the pharmacist and say, "Hey, I want to work with you on this." And then once that happens, the pharmacists are very keen to work with you. I will open it up to the other group for resources because I think they might have some better ideas.
Hi, Maya. Great seeing you again. First, just want to mention that CAPhE is has learned a lot as well, and super excited with the relationship with the Canadian Association of Nurses for the environment as well. From an advocacy perspective, I would say collaborative advocacy is very, very powerful. Recently did a presentation at City Council about a different type of issue, but it was so nice to see nurses, physicians, pharmacists, and other professionals working together, pharmacy professionals and other professionals working together. The other thing I would mention is from an inpatient perspective, we've seen similar things to Trudy, where we're looking at inhaler dispensing and wastage, and then when you have seamless collaboration with nurses, it makes a big difference. Often green teams are kind of, you have a nursing green team and you have a pharmacy green team, but if there are ways to be able to work together, I think that is also very useful. And that becomes even more something to think about with regards to both pharmaceutical waste at returns and plastic waste as well. So definitely a lot of opportunities for multiple levels of engagement, both at the local level and the national level, and even the international level. The last thing I would say is Cascades Canada has a really good inhaler comparison chart, which is like kind of ready and printable and could be used, and certainly available at nursing stations or within primary healthcare facilities as well.
And also, if I can jump into, as I shared in my presentation, we're still at the early stage for, all the mitigation and carbon footprint impact. So we do hope that as research and funds are injected, that we can learn more. So it's not only on inhalers, for example, or desflurane, but if we have even more information, then as information is trickling in, then we hope that we can develop those tools. And Cascade, again, has already tools, and so then more tools will come our way so that we can share more knowledge. But it will take a little bit of time, right? Thank you.
Miles, you're on.
Thanks, Shaliza. Just one quick question for Tarek. Is there any info on social prescribing and the impact on meds? You were talking about the decreased cost to the system, the decreased ER visits. I mean, it almost has to have an impact on prescriptions. Is there any research there?
I don't have something like in ready right now, but definitely I'm seeing lots of evolving research. But you think about, I always see that deprescribing and like I always thought that even deprescribing, I would consider it as a kind of a social prescribing, to be honest, because we're reducing the medication that the patients that were put on originally because of social related issues, not because of a real condition like antidepressants, deprescribing benzodiazepines, which is a huge thing. And I got involved in the last few years in some nasty kind of ones. Like it takes the last one I did, it was 0.5 milligram clonazepam, half tablet, and it took the patient 6 months to get rid of that half tablet, because she was so attached to the medication. And so I think that is also something. But I see the direct kind of like impact coming from reduced number of visits, reduced burden on healthcare system, like hospitals and ER and all that stuff. I also see the reduction in number of medication, as I said, if we do the prescribing. So I think they go hand in hand.
Excellent. Well, that was a great talk. Thank you, everybody. And we'll have to do this again next year. Right? Have a great day,
Sounds
everyone.
great.
Thanks for coming.
Thank
Thank
you.
you so
Thanks
much.
for having us.
Bye-bye.
Bye.